Pulmonary embolism sounds like a clinical term you'd hear once and forget, but in reality, it's one of the most sudden, dangerous, and misunderstood medical emergencies. Because it doesn't announce itself loudly, it creeps in quietly and then strikes fast often when people least expect it. And that's exactly why it has become such a talked-about topic lately, especially as more high-profile cases and personal stories surface online, pulling attention to how serious it really is. A pulmonary embolism happens when a blood clot, usually formed deep in the leg, breaks loose and travels through the bloodstream until it gets stuck in the lungs, blocking blood flow and suddenly starving the body of oxygen. And the scary part is that this can happen to people who think they're completely fine. People who walked, worked, trained, traveled, and went to sleep without any idea that a silent threat was already moving inside them. What makes pulmonary embolism so dangerous isn't just the clot itself. It's how easy it is to miss the warning signs because symptoms can feel vague or misleading at first. Shortness of breath that feels like anxiety, chest pain that feels like a muscle strain, dizziness that feels like exhaustion, or a sudden cough that doesn't seem serious. And because these symptoms overlap with so many everyday issues, people often brush them off, delaying treatment during the most critical window. And that delay can be the difference between recovery and tragedy, in the UK especially. Doctors have been stressing awareness because pulmonary embolism doesn't discriminate by age the way people assume. While it's more common in older adults, it can and does affect younger people too, particularly after long periods of immobility like long-haul flights, long car journeys, desk-bound work, recent surgery, illness, pregnancy, or even dehydration. And that's where the story becomes unsettling. Because modern lifestyles quietly increase the risk without people realizing it. Hours sitting still, scrolling, working, traveling, all while blood flow slows just enough for clots to form. The body usually dissolves small clots on its own, but when it doesn't, that clot can travel. And once it reaches the lungs, the effects can escalate fast, oxygen levels drop, the heart strains to push blood through blocked vessels, and the body goes into crisis mode. Which is why pulmonary embolism is considered a medical emergency every single time, not something to wait and see about. What's even more frightening is that in some cases the first symptom is collapse, which is why awareness matters so much. Recognizing earlier signs can save lives. Sudden unexplained breathlessness, sharp chest pain that worsens when breathing in, coughing up blood, a rapid heartbeat, lightheadedness, or one leg being swollen, warm, or painful before any chest symptoms appear. Those are red flags, not inconveniences. And the moment they appear together, the risk increases. Doctors diagnose pulmonary embolism using scans and blood tests. And once confirmed, treatment usually starts immediately with blood thinners to stop the clot from growing and prevent new ones forming. In severe cases, stronger medication or procedures are used to break the clot apart. And while the idea of blood clots sounds terrifying, the reassuring truth is that with fast treatment, many people recover fully and go on to live normal lives. But recovery isn't always instant. Fatigue, breathlessness, and anxiety can linger for months, reminding survivors just how close they came to something life-changing. And that emotional side is rarely talked about: the fear of recurrence, the sudden awareness of one's own mortality, the lifestyle changes, the daily medication. All of it becomes part of a new normal, which is why pulmonary embolism isn't just a medical condition. It's a wake-up call. It forces people to listen to their bodies, to take symptoms seriously, to move more, hydrate, and understand risk. And that's why conversations around it are growing. Because every shared story chips away at the dangerous idea that it happened to me. Pulmonary embolism doesn't care about fitness levels, job titles, or plans for tomorrow. It only cares about timing and awareness, and the more people know, the faster they act, and the more lives are saved. So when this condition comes up in the news or in conversation, it's not just another health headline. It's a reminder that some of the most serious threats are the quiet ones, the ones that rely on being ignored, and that recognizing the signs, acting early, and respecting your body can turn a silent killer into a survivable moment, and that knowledge alone has the power to change outcomes, protect lives, and make sure that what starts as a frightening diagnosis doesn't end as an avoidable tragedy.